together with external male genital organs. And now internal testes, deferent ducts, seminal vesicles, prostate, to here. And you need to draw one diagram, that is this diagram together with this. We combine two diagrams and you need to draw it. That is testes. And behind of testes we have epididymis. Greek name of testes, that is orchis, or didymis, that is epididymis, that is structure which is near or behind of testes. Testis has external fibrous coat, that is tunica albugina, and this coat comes into the testis and separates it into numerous lobules. Near 300 lobules in testis, and each lobule separates from another with the help of septular testis. In lobule we have convoluted seminifery tubules, usually two convoluted tubules, which join together and makes straight tubule. One again, tubuli seminifery contorti, that is convoluted tubule, and two tubules joined and makes one straight tubule, tubuli seminifery recti. Convoluted tubules, I put here number 1, tubuli seminifery contorti, that is place where spermatozoa produced. And all in other ways, that is ways for which pass spermatozoa on the way from testis to environment. That is why straight tubule, that is number 2, tubuli seminifery recti, they makes network, rete testis, number 3, rete testis, and from rete start ductuli efferentes. Ductuli efferentes goes to the head of epididymis. Epididymis consists of head, body and tail. Here it is tail. And ductuli efferentes, I put here number 4, ductuli efferentes, goes to the head of epididymis, and here they join together and makes ductus epididymidis. Number 5, here, 5, ductus epididymidis. And this duct from tail of epididymis continues into deferent duct, ductus deferens, ductus deferens. Number 6, that is deferent duct. This deferent duct behind of testis has name pars testicularis, or another name that is pars scrotalis, because it is in scrotum. Number 7. Then pars funicularis, it is in spermatic cord. Number 8, that is pars funicularis, it is in spermatic cord. Then inguinal part, it is in inguinal canal, pars inguinalis, number 9, and it continues into true pelvis, that is pelvic part, pars pulvina, number 10. And pelvic part of deferent duct goes to the urinary bladder, okay, that is urinary bladder, here it is male urethra, here it is prostate, and here seminal vesicle. And deferent duct near of seminal vesicle, it dilates and makes ampulla ductus deferentis, put here number 11, ampule of deferent duct, ampulla ductus deferentis, and this ampule joined together near of prostate gland, it's joined together with excretory duct of seminal vesicle, number 12, that is seminal vesicle, number 13, that is excretory duct of seminal vesicle, and now two ducts, deferent duct or ampule of deferent duct, together with excretory duct of seminal vesicle. They join together and continues into ejaculatory duct, which passes through prostate gland. That is number 14. Ejaculatory duct. And ejaculatory duct opens into urethra, number 15. It is another ejaculatory duct. 16, that is urinary bladder. That is a pathway of seminal fluid from convoluted tubules into straight, from straight tubules into rete testis, then ductuli excretorii, then ductus epididymitis, then ductus deferens, then ampoule of deferent duct, then ductus excretorius together with deferent duct makes ejaculatory duct and goes to the urethra. Now, some words about prostate gland. If we cut prostate gland in horizontal level, we will see this picture, that is prostate gland. You need to draw only this diagram next time, only one diagram, all another for your understanding. And urethra, it passes through prostate gland, not through the center. It's near of anterior surface. This is anterior surface, here it is posterior surface. This is urethra, and posteriorly ejaculatory duct pass through prostate and opens into urethra. And now we speak about 3 lobes of prostate gland. This is right lobe. Oh, sorry, that is that is left, of course. That is left lobe, lobus sinister, left lobe. Here it is right lobe, and this is lobus medius, middle lobe. A middle lobe in space between 2 ejaculatory ducts, and left and right lobes laterally. I want to draw one again, urethra. Urethra, this part of urethra inside of prostate gland, that is male urethra. Here it is prostate gland, and posterior wall of urethra. Here it is. Here it has eminence, that is colliculus seminalis. That is eminence on posterior wall of male urethra, and on the apex of this colliculus seminalis, we have blind fossa. This fossa has name utriculus prostaticus, and ejaculatory ducts, ductus ejaculatorius, opens into urethra near of this utriculus prostaticus, that is opening of ejaculatory duct. And laterally from colliculus seminalis here, a lot of small openings of prostatic glandules. We have glandula prostatis, a lot of glands inside of prostate, and they produced secret which it stimulates spermatozoa, stimulation and nutrition of spermatozoa. The same like seminal vesicles. And glandula prostatis opens into urethra laterally from colliculus seminalis. And on the apex of colliculus, near of utriculus prostaticus, that is opening of ejaculatory duct. Some words about spermatic cord. Here it is, we can see deferent duct, and deferent duct, it is part of spermatic cord, and spermatic cord consists of deferent duct, some vessels, for example, arteria testicularis, vena testicularis, arteria of deferent duct, arteria ductus deferensis, nerve, that is genitofemoral nerve, it gives a genital branch, ramus genitalis, and some codes of the testes makes spermatic cord. And now I want to explain codes of the testes. Maybe you know that testis develops in abdominal cavity. If it is abdominal cavity, here it is abdominal cavity, that is diaphragm, here it is peritoneum, and behind of peritoneum, here it is present, that is in different sexual gland, which develops in male into the testes, in female into the ovary. And peritoneum makes blind process, and this blind process of peritoneum grows downward together with ligament, that is gubernaculum testis, that is grid of the testis, connective tissue which grows downward and move testis from abdominal cavity into the scrotum. And look here, that is anterior abdominal wall, that is skin of anterior abdominal wall. And skin of abdominal wall in time of descendance of testis continues into the skin of the scrotum. And testes descend into the scrotum. Here it is testis, that is testis, here it is epididymis. And skin, put here number 1, skin of anterior abdominal wall, it makes skin of the scrotum, letter A, that is skin of the scrotum. What is under the skin on anterior abdominal wall? Tell me, please. What is under the skin? Fat, subcutaneous fat. And subcutaneous fat continues into the scrotum, into subcutaneous connective tissue, which has smooth muscles, smooth muscular fibers. Connective tissue and smooth muscles. Fat tissue, here it is reduced, and only connective tissue and smooth muscles. That is second layer of scrotum. That is letter B, that is tunica dartas. Tunica dartas develops from subcutaneous fat, from subcutaneous connective tissue, and consists of connective tissue and smooth muscles. What is under the fat? What is next? Layer of anterior abdominal wall. What is under the fat? Help me. Superficial, what? Fascia. Yes, fascia. Superficial fascia. And this fascia continues to the scrotum as external spermatic fascia. External spermatic fascia, that is next coat of the testis. I put here letter C. C, that is external spermatic fascia. It develops from subcutaneous fat. Next coat, that is another fascia, fascia intercruralis. It is present in the region of superficial inguinal ring. Put here number 4. Fascia intercruralis, and this fascia continues into cremasteric fascia. Fascia cremasterica. It is next coat. Put here letter D. Cremasteric fascia. Next, muscles. Muscles of anterior abdominal wall. Now I draw transverse abdominal muscle. Musculus transversus abdominis. Number 5. Transverse abdominal muscle continues into the scrotum as musculus cremaster. Cremaster. That is musculus cremaster. Musculus cremaster, letter E. What is behind of fascia, of transverse muscle? We have fascia transversalis, six layer on anterior abdominal wall, that is fascia transversalis, and this fascia continues into fascia spermatica interna, internal spermatic fascia. Put here letter F. Fascia spermatica interna. And last coat, that is peritoneum. Peritoneum, 7th coat, number 7, peritoneum. Peritoneum, I already said, it gives blind process. It has name processus vaginalis. Processus vaginalis, in time of descendance of testis. And this processus vaginalis, it separates from peritoneum in abdominal cavity, separates from it. It is disappear. And we receive last coat, put here letter G, that is tunica vaginalis testis. Tunica vaginalis testis. It is peritoneum which separates from peritoneum of anterior abdominal wall and makes blind coat which is surround testis. It consists of parietal layer and visceral layer, and space between them, that is cavum vaginalis testis, where may be fluid in time of inflammation, or blood may be in trauma. That is cavitas vaginalis testis, and tunica vaginalis. It is serous coat which is surround testis, and it is part of peritoneum. You need to know names all of these coats and how they correspond to the layers on anterior abdominal wall. Which layer on anterior abdominal wall correspond to which coat of the testis. And now, I already said about spermatic cord. Okay, that is testis, epididymis, here it is deferent duct. I said that spermatic cord consists of vessels, artery, vein, here it is plexus pampiniformis, that is venous plexus, nerve, genitofemoral nerve, and some codes. Here it is, we have fascia cremasterica in spermatic cord, musculus cremaster, here it is, and fascia spermatica interna. These codes participate in spermatic cord. Skin here in spermatic cord is absent, tunica darta the same, absent, fascia spermatica externa the same, but fascia cremasterica, musculus cremaster, and fascia spermatica interna, all of them present in spermatic cord, and spermatic cord between testis and inguinal canal. That is testis. Here it is epididymis, and you can see that between testis and epididymis we have space. This space we can see only on the lateral side. Medial side, here there is no space between epididymis and testis, only on the lateral side. And this space has name sinus, sinus epididymidis. Sinus epididymidis laterally between testis and epididymis. That is why, is it right or left testis? Tell me please. It is right. Now I take in my right hand, epididymis is behind of testis, and sinus looks laterally. If I take in my left hand, what happened? Now sinus looks medially. If I take this way, now sinus looks laterally, but epididymis now in front from testis should be behind. That is why it is normal position. That is right testis, because sinus looks laterally. Now, this is spermatic cord, and spermatic cord consists of deferent duct, ductus deferens, vessels, nerves, and some codes, fascia cremasterica, musculus cremaster, and fascia spermatica interna. Now, this is male urinary bladder, that is apex, here it is fundus. This is ureter, that is right, and here it is left ureter. Next, this is seminal vesicle, and here it is broken, should be deferent, that is seminal vesicle, and here should be deferent duct. Deferent duct here is absent, only part of seminal vesicle we can see. Next time maybe we will see another preparate, try to receive another preparate where deferent duct and seminal vesicles are present. That is prostate gland, and that is all. This is female urinary bladder, looks like female urinary bladder, that is, here it is apex, that is base, cervix, body, that is urethra, here it is triangle, trigonum vesica, where folds are absent. That is all. That is part of ureter, and here it is beginning of urethra.